Good afternoon. My name is Ryan Tarrant. I'm the President and CEO of the Bay Area Chamber of Commerce. Welcome to today's virtual COVID-19 meeting. Today we're going to be hearing from State Representative Brian Elder, Bay Aranac ISD Superintendent Deb Kadish, and Bay Future President and CEO Trevor Keys. We know that these are challenging and uncertain times for businesses, employees, teachers, and their families. That's why here at the Bay Area Chamber of Commerce, our team's been working diligently to advocate on our members' behalf and keeping them informed. We know that last Friday, the governor issued a new executive order that lists some of the restrictions that we've all been living under for the past several weeks. And before I turn it over to State Representative Brian Elder today, I just wanted to kind of walk through the outline of today's virtual platform. You'll see at the bottom of your screen, if you move your mouse, a Q&A icon. We would ask that any questions for today's panelists be directed through that Q&A platform. And at the end of the presentations, I will go ahead and moderate and ask those questions of each of the panelists. So I will also be reminding everyone how that's working. For those who have been on Zoom meetings in the past, you've probably all used the chat. We will not be using the chat. We'll be using solely that Q&A icon. Our first panelist today is State Representative Brian Elder. Representative Elder is in his second term representing the 96th House District. That includes the cities of Bay City and Essexville, Bangor, Frankenlust, Hampton, Cauquelin, Merritt, Monitor, and Portsmouth Townships here in Bay County. Representative Elder serves as the Vice Chair of the Agriculture Committee and also serves on Judiciary. State Representative Elder, welcome, and let me get you unmuted here, and you should be ready to go.
All right, thank you very much, Ryan. First, I want to thank the Bay Area Chamber of Commerce for setting up this meeting. And I want to let everybody know that for the last several weeks, I have been having weekly teleconferences with Ryan, Trevor Keys from Bay Future, and Matt Fallon from the Great Lakes Bay Regional Alliance. And really, that's been instrumental in the work that I have been doing for the last few weeks. Each of these gentlemen have done an outstanding job of listening to the concerns from their membership organizations and then bringing those concerns to me. And in turn, we've been quite successful at meeting some of the challenges that I know that all of us are facing. So I'm just going to kind of dive right in. And I think that to understand what we've all been dealing with, probably we want to start with some basic statistics. Here in the state of Michigan, to date, we have 37,778 positive cases of COVID-19. In the region in which we exist, the region as defined by the Department of Health and Human Services, and I think you can see a map that we just put up. We are in what DHHS calls Region 3. This map can be a little hard to decipher, especially if, like me, you need bifocals. There are two different colors, and we are in a place that is kind of like a salmon or a pink, but Region 3 actually stretches all the way north to Oscoda and Alcona counties, goes through out into the Thumb and includes Sanilac and Lapeer counties. That region to date has had a total of 2,544 positive cases. And then finally, in our county of Bay County, we've had a total of 120 positive cases, and that is with 2 deaths. The most recent information from the state of Michigan indicates that we've had 3,315 deaths. So, as everybody understands, we are in the midst of a pandemic, and because it is caused by a virus for which we do not currently have a vaccine, we are going to be working through this pandemic certainly for the midterm. It's not something that we can turn a light switch on or off on. And so regardless of what we're doing, we'll be dealing with this in some way for the next several months. A word a little bit about regions, because I know that some of us in Lansing are taking a really hard look at trying to adopt a regional approach for our next steps, and that's something that I am open to. Of course, as my old law professors would tell me, it's the devil's in the definition. So if we take a look at the map here, you can see that the region is quite large. This would not necessarily be a region that would be adopted going forward for social distancing or economic limitations. But let's just take a look at the region that we are currently in right now. Bay County, Saginaw County, and Genesee County are inside of Region 3. As of today, I've reviewed information that indicates the top 10 counties in the state of Michigan that have for per capita COVID tests. And naturally, the top 3 are Wayne, Oakland, and Macomb. That's our highest population density in the entire state of Michigan. The next 2 counties are 2 counties on the west side of the state. And they're on that list because their populations are very small, and so their per capita rate is higher. But the next 2 counties are Genesee County and Saginaw County. So going forward, if we do adopt a regional approach, it's highly likely that Bay County and Saginaw County would be inside of a region. Our populations work with each other. We live in one county or commute to work in another county, and engage in shopping and entertainment. We are very closely connected, and Midland as well. And often whenever we look at regions, maybe they're from the federal government and their metropolitan statistical areas, often Bay County is included with Genesee County also. So when I personally think about a regional approach, I always want to make sure that we get the best possible result for the constituents that I serve. And if my county is in a region with Saginaw and Genesee, what we would have to envision is that those 2 counties have the cities of Saginaw and the city of Flint respectively, and those populations have many of the same earmarks that the populations of Southeast Michigan have in terms of access to health care and the likelihood that you will have positive rates, and also, unfortunately, the likelihood of a higher mortality rate. So before I personally join into a regional approach with both feet, I need to make sure that my county is being taken care of and is safe, but also that we're not surrounded by counties that are kind of wide open for business while our own businesses are restricted. So just one of the factors that many of us are looking at as we go forward. What we know is that in the state of Michigan, as of right now, we have passed all of our peaks, barring some unforeseen new spike. So in the state of Michigan, we reached our peak on April 3rd, 2020. And there's a distinction between your peak cases and what's called a sustained decline. So at the chart that I'm about to show you, you can see that, as soon as it's up, there it is. You can see that this is actually our region, but this more or less mirrors what we have in the state of Michigan. You can see that there are peaks, but a consistently gradual decline. And that's really what we want to see. We know that in the region in which we exist, our peak was on April the 6th. And we know that in Bay County specifically, our peak in cases was on April the 9th. What we want to do is make sure that we have a sustained decline for 14 days. And that's a number that comes to us from the federal government. from those public health experts, from the CDC, and in turn, that's being echoed by the Michigan Department of Health and Human Services. So what we know is that for our state, for our region, and for our county, all of our numbers are going in the correct direction. And it's those numbers that have allowed us to have a recent loosening of some of the restrictions in our executive order. Those are the things that we're all looking at every single day when they get posted, just to make sure we're heading in the right direction. So what do we do with those numbers? Well, here in the state of Michigan, we are fortunate to have the University of Michigan, which is one of the premier research facilities in our country and therefore in the world. And we have an outstanding team of epidemiologists that are doing the modeling specifically for our state. That's important to point out because as all of us consume the news and try to be well informed, sometimes numbers will not necessarily match. And that's not because someone's doing anything wrong, it's because when we report numbers, we are literally just reporting whatever we have tested or whatever it is our report is supposed to tell you. So sometimes positive cases or trajectories look a little bit different. That's because they're typically it's because they're asking slightly different questions. Everything that we do in the state of Michigan that the governor has been working on is based upon University of Michigan's modeling. And just a little word about that. Yeah, go ahead and pull that up.
Social distancing.
Yeah, and by the way, the person who is far more technologically savvy than I am is my new legislative director, Attorney Aaron Zettel. Comes to us from the UAW and used to be the Deputy Chief of Staff for the Democratic House. Okay, so in these charts, in the very first one in the upper left-hand corner, you can see what's happening as the cases started to increase in the month of May, or I'm sorry, in the month of March. At which time we asked questions: what happens if we do nothing? If we take no steps whatsoever? Yeah, go into the social distancing. What happens if we simply let this particular virus take its course? Because naturally, there are other diseases or infections in which we adopt that approach. The one that we think of most often is H1N1, something we refer to as the common flu. And we don't engage in these kinds of measures with the common flu, although we do educate people and try to make sure that they make the choices about getting vaccines and making those widely available. Okay. So, ready?
Yep.
Okay.
Social distancing.
All right. So social distancing. Right now, I've got something up that will show you what happens based upon different policy decisions that we might make. So right now, what you're seeing in the black is what would have happened if we had taken no action whatsoever. You would have seen what truly would have been a horrific spike in the state of Michigan in the month of April. And then through this particular website, you can try to make choices. So for example, let's suppose we go down to a social distancing regime in which we have 25% social contact. Nope, 25. Yep.
That's no, 25 is this one. That's
Okay.
25. Yeah.
All right. Okay. So let's suppose that we just barely had restrictions. You could see that the spike in cases would have been smaller than doing absolutely nothing, but really would not have addressed the situation that we're in. Instead, let's look at what we decided to do here in the state of Michigan.
This is what we decided.
Oh yeah. Okay.
So this is what happens if we have no restrictions at all.
Yeah. Okay. Thank you very much. If we go to a regime in which we kind of go cold turkey, right? We just say we've done what we can, and therefore we're not going to have a gradual re-engagement. This is what happens in the state of Michigan. Things flatten out for a bit, but then come this fall, you have a horrible backlash. And so when the decisions are getting made from the executive branch, from Lansing, that is why we're making the decisions that we are in fact making. Here in Bay County, I've had the opportunity to have great interactions with the Bay County Health Department, and we're really fortunate to have Joel Strauss as our Chief Health Officer there. In Bay County, they are already trying to determine what their next steps are. And so what they want to do in Bay County is, as testing becomes more available, naturally we continue tracking the information we have, but that testing we have locally is what's going to help determine local decisions, because it is the Bay County Health Department that actually makes our local decisions in terms of what businesses are safe to operate. Couple of things about what we're looking at Bay County. We are working to make sure that when testing is conducted, that it's appropriate testing, that it's been approved by the FDA, and that testing is actually reported to the County of Bay. Because right now, there are some entities that are offering testing for sale. We don't know necessarily whether or not they're the correct tests, and they're not doing the final extra needed step of reporting that information to Bay County. Because if you have lots of negative cases, naturally we want to know about that, because then that helps us make informed decisions going forward. I know that in Bay County, they are taking a hard look at what it means to reopen the public schools in the fall. Under what circumstances can students attend class safely? We also know that in the County of Bay, we've got a population of approximately 550 students who have underlying health concerns, for whom, regardless of what we do as a state or as a region, they specifically will be at added risk because of autoimmune conditions, perhaps they're type 1 diabetics, and that's a special concern that we're looking at in Bay County. And in addition, here in Bay County, we pay a special millage for mosquito control. Going forward, we think it's likely that mosquito control is going to be an incredibly important part of facing this particular crisis. One final thing before I turn it back to Ryan, I just want everybody to understand that while this is an election year, and while everyone has different styles of messaging, if you go through all of the moves and the edicts from government, whether that's the federal government or the state government or the local government, and you actually read it, we are in overarching agreement on everything that we do. It may not seem that way because of the way public office is covered by the media, and because of the things that folks might try to focus on. But in reality, the federal government and our state government have agreement of 99.5% of the issues. We're all looking at the same timelines. We're all looking at the same test rates. We know that we are, our governor has entered into a Midwest Compact, and that's a coalition of surrounding governors, some of whom are Democrats, some of whom are Republican, and they are all in lockstep with one another. It can seem as if we're all disagreeing, because honestly, it's an election year, and you focusing on where we disagree is part and parcel of campaigning. But in reality, your public officials and your public health officials, most importantly, really are on four squares with one another, and that's why we're making these decisions together. So with that, I'm going to hand it back to Ryan.
Thank you, Representative Elder. We appreciate that, and don't go too far, because I think we're going to come back to you and then have some questions at the end. Just a reminder for everyone, if you have questions for any of today's panelists, to use that Q&A icon and type your question. And at the end of the presentations, we will get back to those. Next up, we have Superintendent Deb Kadish. Deb is with the Bay Aranac ISD, where she has been since September of 2010 and has served as superintendent since July of 2012. Deb, would you like to share some updates on how education has been impacted and what the Bay Aranac ISD and maybe potentially some of our other school districts have been doing during this time?
Sure. Thank you, Ryan. I really appreciate being able to do this. I know that information about the schools and all the things that are happening is coming fast and furious via the TV, via Twitter, Facebook, and everything else that people put things out of, but sometimes it's important to kind of come back and look at a big picture. So for us, this started around March 12th when there were beginning conversations about closing schools, at least for a short period of time. We were looking at approximately 3 weeks at that time. But our organizations in the state, the State Superintendents Associations and also the ISD Association, worked with Dr. Rice, the state superintendent, and the governor to put a package together that says we're going to try to do this as streamlined as we can. So for us, the ISD became the point person for what happens across the state as far as schools. There's 56 ISDs, 700 in some school districts, so it becomes a little bit easier to share information in that way. The first challenge we had was childcare. We have many childcares that run through the ISDs and also the locals, and the governor's concern, as well as the state superintendent, was keeping these childcare centers open for first responders, for healthcare workers, because if students are not able to go to some kind of childcare, parents can't work. And so that was something we were able to work through, getting meals set up at all the different locations that they need to be, being able to provide support to the locals to have meals, be able to deliver. We have right now about 70 families across Bay County that don't have the ability to have transportation to get to where the meal pickups are. So being able to get those actually taken to their home via bus routes or other ways that they can do that. Gathering PPE equipment. We're very lucky at the ISD. We have a very active career center and worked to find programs at the career center that had PPE equipment that could be donated out in places, and even to the locals where food service workers who are out on the front lines in that way need to be able to be protected. When the decision came that school was going to be closed for the rest of the year, and I say it that way because that's the way everyone asks me, why is school closed? School's not closed. School buildings are closed to face-to-face instruction, but school continues to go on. And in Bay and Aranac counties that the ISD serves, it has continued to go along all along. Meals have been delivered from just a few days after or picked up. The childcare, as I said, and then the districts, along with us, trying to figure out what do we need to do to get devices into students' hands, to be able to work with students, to not have large gaps of time go for their instruction. It's concerning to me that as we look around the state of Michigan, and we've done a lot of looking at this in this time period, we're probably only between 60 and 70% of our students being able to have even internet access, if not a device in their hands. And that's very concerning because they can't have school in the same way as everyone else. So that's something we've been working at. As you've seen, you know, in the media, all the districts are focusing on their remote learning plans. I'm excited about the fact that the remote learning plans for Bay and Aranac counties and for the rest of Michigan needed to be started by tomorrow. Most of them started about the 13th. So we've got a couple of weeks ahead of getting out information, instructional materials. If families are lucky enough to have internet access and a device, being able to do things online. If not, packets of information, equipment going home. You know, it was important to hear the comment about students with health concerns. We have, in Bay and Aranac counties, we have quite a few students that attend our campuses with many health concerns, physical as well as medical, that we have to think about and how do they get their services. As we think about where we go, the governor was very clear as was the state superintendent, that we don't want to hurt students in any way in this. So our remote learning plans that are called continuity of learning is really focusing on how do we get students everything we possibly can get them between now and the end of the year. It isn't normal school. It does have to be looked at differently. You can't do everything online that you can do other ways, but how much can we do and how successful can we make it be? Also supporting families and students just because of the situation. This is a scary time for kids. They're not going to school. They're not around their friends. They're not around their teachers, people that they miss. How do we support that at home? All of the physical issues, all of the mental health issues, as well as the academic issues. Sometimes in this picture, the academic issues are minor compared to some of the other issues. And so there's a lot to focus on. I know people have concerns about what comes next. We do too. The governor and the state superintendent have been clear that the buildings are closed for the rest of this school year as far as face-to-face, but that really only ends right now at the time our school year ends, which for most of our districts is by the middle of June. We're trying to look at what does that mean for next year? What does that mean for this year? Just an example, at the Career Center, and in any of our CTE programs around our districts, and many of them have them, it's very difficult to do hands-on learning over the computer. Are those students going to be able to get a certificate for welding or for electrical work or for any of the things they're doing? Or are we going to have to look at something different for the summer? Most of our districts haven't done summer school for a long time. That's really not something we do anymore, but enrichment kinds of things. So we're hoping that this picture continues to get better, as Representative Elder showed us. I think that's extremely important, because I'd love to see, in my perfect world, in June, we can get back in buildings and be able to start offering things. Do we offer enrichment programs so the students aren't as far behind in the fall? Do we offer things that allow seniors who are graduating but need certificates for where they're going next, to Delta or wherever? One of the things that we struggled with, and all the districts have, is the Executive Order 2020-35 was silent about early childhood. Early childhood isn't something that was a definition for us. Both with early childhood, with special education, with lots of the special activities that enhance the K through 12 programs we have in our districts, there are a lot of federal rules, adult education, all of the additional programs we offer, and those federal rules are still needing to be followed. So all of our districts are continuing to provide early childhood services, whether they're just communicating on the phone or on the computer with a parent, or whether they're providing some form of service that parents are able to do at home with instruction from staff. So we had been hoping we would get more guidance about early childhood, but we just decided to take the chance. So that's a huge population of students and families that need help. And so all of our districts and the ISD are continuing to provide those services in the best way we see fit, even though there's not specific direction. The one thing we're lucky, we have a waiver for pre-Labor Day start. So most of our districts are starting mid-August, opening days around the 17th or 18th. Lots of districts are still in the state not starting until after Labor Day, which I think is now September 7th or 8th. So we have a nice jump if we can go back to school for a typical opening. If not, I think we really have to think about how much work we have to do to really think about our families being able to function in an online system, because 60 to 70% of our student population is not good enough for being able to have this kind of communication. And so that's probably our biggest concern right now. I think we feel great about how much our districts and our state has stepped up to do what they need to do. We meet regularly, weekly, with the state superintendent. The governors come to many calls. Our local superintendents and I meet every week, sometimes more than once, just to figure out what do we need to do next. But everyone's going for the sky, because that's all we can do right now, and the kids deserve it.
Great. Thank you, Deb. Appreciate that. Next, we're going to pivot a little bit and talk about some of the assets and resources that have been available to businesses during this time. One of the big ones, obviously, is the Paycheck Protection Program. Originally, that was a $349 billion program that was signed into law. And I know that that was a lot of fits and starts, and there was a lot of frustration with that program going into it. But having spent nearly 2 decades in federal government, kind of seeing some of those programs over the years that had been set up, a program of that magnitude that's passed, generally the Small Business Administration or any other federal agency would have 6, 12, 18 months to kind of determine how to roll that out, what the application process looks like, and all of the things that go with it. From the time that this was signed into law by the president, it was 7 days until the applications went live, and then it was another 7 days before some of that money actually started flowing. So, instead of being, 6 months or longer, within 2 to 3 weeks, that money was flowing back into small businesses. And then obviously everybody knows, roughly a week, 10 days after that, that $349 billion was exhausted. Late last week, Congress approved and the president signed an additional $320 billion into the Paycheck Protection Program. As I understand it, that money is starting to go live, and those loans are starting to be approved as early as this morning. And from the reports that I've seen, that money is expected to last between 24 and 72 hours. So, if there's anyone on the call who's still considering, whether they want to apply for it, I would encourage you to do that as quickly as possible, because that $320 billion is expected to go pretty quickly. The other part of that was the economic impact disaster loans. That supplemental package last week also approved an extra $60 billion in economic injury disaster loans, and wanted to talk a little bit and have Trevor Keys from Bay Future. Trevor's the president and CEO of Bay Future. Kind of walk us through some of those assets and resources if we could. Trevor?
Yeah, hi, thank you, Ryan, and thank you to the rest of the panelists as well. I think fantastic information for a lot of the attendees today, and those that'll be watching later on the Chamber's Facebook page once this gets loaded up. Some of the biggest resources that companies have been asking us about have to do mostly with capital and loans and grants. A part of that was the Michigan Economic Development Corporation and the Michigan Strategic Fund was extremely proactive in putting dollars out into local economic development organizations to then decipher and delineate those funds to small businesses. And that was very early on as we started going through the motions of what this pandemic has continued to be. Through that process, Bay Future, along with the other economic development organizations within the Governor's Prosperity Region 5, or former Governor Snyder's Prosperity Region 5, put together an application process that was based off of the executive orders for the Michigan Small Business Relief Grant and Loan Program. What that program was able to do was provide our East region, which is Bay, Saginaw, Midland, and Aranac counties, $400,000 to allocate towards businesses. So we've gone through that program and deciphered or delineated or rather distributed those funds to small businesses that were through a myriad of different criteria. We then reached out to, and the Dow Chemical Company was so gracious as to match a portion of those dollars. So we were able to put investment back into our economy through those small business grants. Now we're looking to continue to do those into the future from a local level, and we're looking at ways in which we're going to be able to do that, looking at partners. From a local level, if you're a nonprofit organization, there's going to be a loan fund that's going to be available through the Bay Area Community Foundation, which is going to be important to take a look into. Those dollars that were made available through the Michigan Small Business Relief Grant and Loan Program are going to be for similar use as what we're looking at for Paycheck Protection Program. Payroll, rent, those types of expenses for that program. Those are really the needs that we're hearing from most of our companies currently, even ones that are technically closed, but whose doors are still open. That application for Paycheck Protection Program, the new application, if you will, opened up today at 10:30, so it's been open for a couple of hours. We hope that the relief that was injected into this program and passed last Friday, or signed into law last Friday, that those dollars last longer than what the original allocation from the CARES Act lasted. There is a massive backlog from those organizations and small businesses that originally applied a few weeks ago who did not receive funding. So that is open today. You will be applying, if you haven't yet, through your local lender, and I would urge you to reach out to those lenders and speak to your lender about some of these resources that are available, whether it's emergency injury disaster loan or grant programs through the Small Business Administration, or if it's the Paycheck Protection Program through SBA. But these dollars that you're seeing that are put together as stimulus or as part of the CARES Act are coming through the Small Business Administration for small businesses all over the United States, but in our area as well. So that's one thing that I really want to talk about. Forgiveness is basically Paycheck Protection Program specifically. Forgiveness is up to 8 weeks of payroll based on employee retention levels. There's no Small Business Administration fees, which is new for a 7A program, a special 7A program that the SBA makes available. And that will go on until June 30th, or until funds run out of the $350 billion. As far as economic injury disaster loan and economic injury disaster grants programs are concerned, there is an opportunity, if you haven't already, to apply for those loans or additional dollars that were made available through the expansion of the Paycheck Protection Program and the new bill that was signed on Friday. What the grant is going to be able to do, if you do apply for EIDL, is what we're calling it. If you apply for EIDL, you will be provided an emergency advance of up to $10,000. That's for small businesses and then private nonprofits within 3 days of applying for an SBA EIDL, Economic Injury Disaster Loan, if you apply for the grant after you apply for the loan. So there's a little bit of trickiness there, but again, reaching out to your lender is going to help to clear that up, and then also identify for you whether it's going to be something that's going to make sense. During this time, if you have a current SBA loan, there's a debt relief program that the SBA put into place that provides immediate relief to small businesses with current SBA loans, 7As, 504s, or any microloans, where principal, interest, and fees will all be relieved for the next few months, which is fantastic. There's obviously tons of counseling and training that's available through SBA and the Small Business Development Center. But I would urge any of you out there who are looking for kind of a fairly comprehensive list of resources, at least from a state and kind of federal level, because those are the dollars that are really flowing right now, and the ones that we're all hearing about on the news, is to check out the Small Business Administration or Small Business Association of Michigan, who's affiliated with the Small Business Administration through the Fed, and click on their COVID-19 resources link. We also have information on our website that directly links to SBAM's website and SBDC's website, the Small Business Development Center, who's our local small business administrator. And I think that's about it. So please look at those resources. Like I said, if you have questions, please reach out to your lenders, although I'm sure as of, well, all weekend and the last couple of weeks, they've been extremely busy. And if there's any specific questions, reach out to Bay Future as well. We can answer those. Happy to answer those. And then as far as any local funding is concerned, we're continuing to look at ways in which we'll be able to partner with our resources or partner with some granting entities to make additional grants available for small business support. So with that, I'll turn it back over to Ryan and answer any questions. Thank you all.
Thank you, Trevor. Appreciate your time today. And just one point on the Paycheck Protection Program, if that's something you're looking into applying with a lender for, I'd encourage you to visit our Facebook page, Bay Area Chamber of Commerce. We actually posted a 90-second video last week with one of our business lenders, and they run you through in 90 seconds what it is you'll need in front of you before you can apply for that loan. So good opportunity to take 90 seconds, see if that's something that's of interest to you. Now, before we get to the question and answer, and again, I know we have a few questions out there in our Q&A icon. We're going to get to those in just a minute. But if you have any further questions, feel free to punch those in that Q&A icon. At this point, I'd like to turn it over one more time to State Representative Brian Elder and see if we can talk a little bit about the restrictions and maybe predictions that we have going forward. And I'm trying to unmute him now.
All right, can you hear me now?
I can hear you now.
Excellent. All right, thank you very much, Ryan. As we all know, the governor issued a new executive order on Friday, EO number 59, and by and large, it became effective immediately. There was a provision regarding the usage of masks that started on today. I'm going to kind of hit the highlights for that. First of all, it indicated that the stay-home order is extended until May the 15th. So what we know is because we've taken aggressive steps in this matter, we have done a really excellent job of flattening the curve. And that's not the product of a government order. That's the product of 10 million citizens being responsible and well-informed and doing what's necessary to protect our friends, family, and neighbors. And so all of us should feel really very proud about that. So the stay-home order is going to be extended until May the 15th. We know that there was a significant number of activities which resumed. Those most notably were in the areas of nurseries, landscaping, golf courses, fishing with use of a motorboat, bicycle repair shops, and a great many others. Just a short note about those specific items were things that naturally lots of folks were thinking about, but the leadership of the business community here in Bay County helped me to understand the specific details of each of those. And so I was lobbying on for modifications or clarifications for each of those. And in turn, I know that our local business community did a really great job of getting prepared for the loosening of restrictions so they would be open today as of day one. What we know is that for mask wearing, that is all people are supposed to be wearing masks when they are in public spaces. Okay? As private citizens, we are to be wearing masks in private spaces. Inside of stores or businesses, we know that employees are mandated to wear masks. And here's a note about that. What we know is that every state in the country and the federal government is working hard to try to get all of the PPEs, the personal protection equipment that we need. And as a result, they're not readily available in the scale that we would like. And so today, Attorney General Dana Nessel issued some instructions that asked law enforcement to check to see if a business owner is engaging in good faith, really trying to comply. Have they done some research? Have they tried to place orders? And then try to use their discretion as law enforcement to work with business owners to help them to comply. Because we know that when businesses opened this morning, there weren't enough masks to cover all the employees in Bay County or in the state of Michigan. But make your best efforts, keep working towards that, and get there as soon as you possibly can. We know that in order to remain open, every business that is open to the public has got to have a COVID-19 decontamination plan. They've got to restrict the numbers of folks allowed into their stores. They've got to allow for remote work if that's possible. They've got to maintain a 6-foot distance between their customers and their employees. They need to enact extra cleaning and disinfecting measures. They've got to have a process for workers who have elevated temperatures or systems, and overall make sure that they're enforcing the social distancing. Many of the companies that were open prior to Monday, they've been doing that. So if you've gone to grocery stores or if you've gone to some of our larger retails, these types of things were in place. And I know that some of our smaller businesses were working on that. For example, our nurseries here in Bay County were working to become up to speed on all of those measures, and so that they were ready to go when they opened for business today. What we need to do going forward in terms of our predictions is to simply keep, we've got to stay the course. And what that means is we've got to make sure that even as the number of activities that are allowable increase, and they should, as the numbers continue to make to be positive, that we still make sure that we are not shaking hands, that we're not giving hugs to people that we don't live with inside of a household, that we wear the masks, that we make sure we continue to wash our hands vigorously, that we're using hand sanitizer, and to do all of those incremental things that every private citizen has control over to make sure that those numbers on the charts that I showed earlier continue to go in the correct direction. Assuming that the numbers continue to go in the correct direction, then it's reasonable that after May the 15th, we will continue to loosen the restrictions that we have in place. And if you remember, before the first executive order came out on March the 23rd, we had kind of a soft regime in place. We had caps on meetings of certain numbers of people and different directions like that. Eventually, the goal is to flatten the curve by being very restrictive, start coming down from that, and then taper down to where our life gets close to where it was back on March the 1st. But what we have to keep in mind is that because this is a virus, we will likely see an increase in cases in the fall. That's okay as long as we know that we have enough beds at our local hospitals. We have a good testing regime in place, and that we have the level of personal protective equipment that our society needs to keep ourselves safe. Because then, even if the numbers do spike a bit, they will be controllable. The fear that we had in the beginning of March was that if we did nothing and everyone got sick at the same time, it would completely overwhelm the healthcare system. And in Southeast Michigan, that's actually what happened. We know that the hospitals and the doctors and the nurses were completely overwhelmed, and that affected the health outcome for people that got positive. If our numbers go up, but we are prepared, as we are here in Bay County, then we can still have a life that resembles normal. And that's really what we want to do. What we know is that our economy is based upon decisions made by private individuals in terms of purchasing goods and services. And so if the public is afraid, if the public is worried that going to stores will harm their health, they will limit their purchasing. And that means, regardless of executive orders or actions by the government, if people are too scared to shop, then our local economy is going to suffer. So the more that we can stay the course, the more we can engage in all of these best practices, we will get to a point where our lives are semi-normal. Now, we're never going to get there 100% until there is a vaccine. And what we know is that the vaccine, the quickest turnaround we can hope for is 18 months. Okay? And that would really be incredibly efficient. We may see a point where the beginning of next year, as long as we're still doing social distancing, things look semi-normal. But we've got to keep in mind that a lot of us have family and loved ones, and they have underlying health conditions. They might be older. My mother has respiratory concerns in the normal course of her life, and so I'm still going to have to be worried about her until she can get a vaccine for this. So we are in hopefully the mid stages, and if we keep making improvement, then the restrictions will lessen and our economy can improve, but we're going to be in a battle for a little while.
Great, thank you, Brian. I'd like to get over to our Q&A a little bit now. We've got a series of questions here. And what I'd like to do is a little bit, I know we're running up toward the 1 o'clock hour. I'd like to do it a little bit like speed dating. So if I throw a question your way, if we could keep it to as close to a minute or so as possible, whenever possible, that would be great. Coming off the NFL draft, I think we'll put you guys on the clock. First question that we have, Representative Elder, early in the meeting, you mentioned mosquito control, mosquito abatement. And, this one kind of is a question after my own heart, because I will always vote for more money for mosquito abatement. Why is that important for combating COVID-19?
So what the healthcare professionals tell us is that this virus, in many ways, it's not the same as equine encephalitis, but it has a lot of the same patterns, a lot of the same vectors. Our concern is that viruses can mutate, and in the second iteration that's going to come this fall, what happens if it becomes transmissible by mosquitoes? And that's something that we need to be on top of. In the state of Michigan, not all of the counties have millages in place for mosquito control or necessarily do anything to abate mosquitoes. Here in Bay County, we're quite fortunate to have that regime. But if that becomes a new vector in this disease, then that could be something that the state of Michigan needs to help with. Either taking on the work where it's not being done, and specifically something that I'm interested in, helping to pay for mosquito abatement.
Great. The next question, I think you touched on this a little bit with relation to non-medical grade masks for businesses. I know the Attorney General has, asked law enforcement to consider the good faith efforts of businesses. But are there discussions at the state level of how businesses might be able to access a supply of those non-medical grade masks?
I know that the governor of the state of Michigan is working every day to try to get shipments, new shipments of masks sent to the state. The problem, of course, is that so is every other governor. Now, since the state of Michigan was hit, not hardest, state of New York was hit hardest, but one of the states that was hit hardest, we are probably getting larger quantities of supplies, and then those should become available dispersed throughout the entire state. We also know that until you get those products available on the market, that for most of your employees, unless they have an underlying health condition, homemade masks will fit the bill. That is good and lawful under this executive order. So your local communities, I know a lot of people are volunteering and making these at home. Try to tap into those resources, and that's the best thing to do as of today.
Okay. One more, and this kind of goes to one of your committees here. I believe you serve on agriculture. With regards to farming, what can we do to protect the food source? You know, milk processing, meat processing, and farm workers that are critical to that.
Right. So that's an excellent question. And what we know in the national news is that we're starting to see a real problem in some of the largest meat packing facilities in the United States. Who by and large are out west, states like Iowa, Nebraska, South Dakota, they have large concentrations of them. So what's happening in those workplaces is that those specific employers were really not doing what they should have been doing in terms of protecting the workers with masks, putting up shield guards, having workspaces that are spaced out. And that becomes a problem. What we are always concerned about in the field of agriculture is that the consumer feel a really high degree of assurance in what they're eating. And that's why in the state of Michigan, we have a good inspection regime, because that helps. We know that people feel safe consuming our dairy products, then they do better in the market. When people feel safe consuming Michigan eggs, then they will do better in the market. So what we need to do is make sure that we are getting the inspections done throughout the entire country, but here in the state of Michigan also. And when it's a national concern, the funding and the focus has really got to come from the federal government. So in this case, it would be the USDA. And if we can increase inspections, and we can increase those workplace safety measures, then people will feel comfortable and confident in making the purchases that they do. And then in turn, other countries will continue to have the same level of respect that they have for American goods. And that's why we do so well in the national market in the field of agriculture.
Great. Last one, and then I think we're going to kick it over to Deb Kadish for a few education questions. Have you been in direct contact with the governor, and sort of how often do you receive updates from her in the administration?
I'm fortunate that I've been able to develop a close working relationship with the governor over the past 18 months or so in the field of either agriculture or labor, because I'm the chair of the Michigan Legislative Labor Caucus. I'm her go-to person in the legislature. Last year in the month of May, she asked me to help her negotiate the auto no-fault reforms that are going to start this July. So I am in contact with her frequently, and those are direct contacts. But I also have access to her chief of staff and her head of policy. And because of that, when Ryan and Trevor and Matt brought concerns about golf courses or fishing or landscaping here in Bay County, I was able to make the case for each of those, not in a confrontational way as some folks downstate have chosen, but to say this is a good executive order, but when you apply it to 10 million people, you can see there might be some outcomes that either were unintended or we just didn't foresee. And so as the numbers make the case for us, It's let's make some changes going forward. And so that's been a very good working relationship, and I think it's benefited the people of Bay County.
Great, thank you. Now I want to put Deb on the clock. Deb, so are these remote learning plans, do they vary from district to district? Are there uniform standards, and kind of how do they come to those?
So every district has their own continuity of learning plan, but the structure is exactly the same. What happens is that the governor and the MDE has said, you know, we want students at the center. There are certain things that you must do to have this continuity of learning plan approved by the state of Michigan. You must continue to provide meals to all students that need them. You must continue to deliver content to the students in a variety of ways, whatever way is necessary based on your students and your population's needs. That's where the difference is. Maybe one district might have very solid access to technology and ways to do it, and another district might not. How are you going to communicate with families? How are you going to communicate with students? How are you going to monitor what the students do? How are you involving all of your staff? Because one of the main requirements is that you continue to pay all staff in the district as they continue to provide meaningful work and instruction for students. And then can you provide mental health supports and post-secondary kinds of things to not injure students that are at that top level and needing to get something. So the plans all look a little different, but there's about a 15-point checklist that they must document things they're doing, comes to the ISD. The ISD reviews it all, sends it through the Department of Education and also to Treasury. And once all that's done, and it needed to be done by today so that if school hadn't started yet, it could start tomorrow, then the district is assured that they'll continue to receive their state aid as they move forward.
Okay, great. Next question I have related to obviously remote learning. You know, and I know from conversations we've had or that I've had with other superintendents, you know, you guys are doing your best to prepare students not only to be successful with these remote learning opportunities, but also, you know, some of them will be going to college, whether it's next year or the year after, making sure that they're not losing any of those educational pieces, you know, that can set them up for success. Are you guys looking at any sort of a hybrid system if we see a spike in the fall, and, you know, if something like this becomes long-term, you know, who should be setting these new guidelines? Should it be done at the local level? Should it be done at the state level?
Well, I think there's a couple of things. I think the state is the only way that we can cause there to be enough concern and enough pressure to be able to work with the groups and organizations that need to help us get internet access to every student that resides in Michigan. You know, the old story is it shouldn't matter what your zip code is, what your access to education is, and it shouldn't, but it does. You know, we have difficulty in our areas. In Bay and Aranet County, we have difficulty. So we need internet access available for everyone in some way, shape, or form. And students can't learn on someone's phone as a hotspot necessarily. Devices are things that they're not just for games and fun. We need to be able to get them in students' hands and in families' hands so that they can work with that. And then I think the hybrid comment is a good one. I think we're going to have to look at, for students that can't come to school, you know, the old term was homebound, students who were ill or something happened and couldn't come to school. What can we do that's going to not provide lesser of an education? You know, I'm a teacher. I was a teacher. I've always been a teacher. I don't want a computer to take the place of a teacher standing in front of a classroom, or the relationships that kids have with their teachers, their principals, their counselors, their friends at school. But we do have to face that things are going to happen where students can't attend, and we need to do better than what we're doing right now. We're kind of on a very upward curve of trying to figure out how do we do it and how do we make it go and how do we fix it. And I think the positive is, as a group, our local districts and the state of Michigan is all working together to figure out what can we do for kids and how can we make it be easier for them.
Great, thank you. Brian, a couple more quick questions for you, and I know we're running over here, so I'm going to try and maybe give a summary of what I recall you saying a little bit earlier. and then maybe combine a couple of questions here as we near the end. So the question was whether there were any plans to open the state by area or by region, looking at north of Saginaw County and as opposed to some of those hotspot counties like Genesee, Wayne, and Macomb. And as I understood it, as you were talking earlier, yes, those discussions have been taking place, but one of the concerns that you have and that you thought maybe we as Bay County residents should have is that if they look at doing that as a region, we could potentially be lumped in with Saginaw County and Genesee County, which were both, I think you said, top 10 per capita for
Right.
COVID-19 infections. Is that correct?
That's correct. So the concern always is that what happens if the state of Michigan's numbers tell us that the restrictions can lessen, but you happen to live in a smaller region and those numbers are increasing. Right? So and that's something that I've been worried about from the beginning. So it really depends on the region Bay County would be put into. Regardless of where it is, we can practically guarantee it'll include Saginaw County. Absolutely everything that has ever happened regionally has Bay and Saginaw counties connected because our populations really are interconnected.
Okay. The next question, and here's where I'll combine a couple of questions involving vaccines and antibody testings. Is University of Michigan, and I'll expand on that. I think I saw a report last week that Michigan State University was doing some research on vaccine testings. And if we have those local research institutions, and I think we can put your alma mater, Wayne State University, which is our
That's right.
third research institution in the state, into that lump, what would that mean for the region if they're doing research and developing vaccines, and then to piggyback on that, whether there's any word on antibody testing and what that could do for reopening our economy a little bit more quickly.
So because we live in the state of Michigan, we really are blessed having 3 tier 1 schools that are large research institutes. So what does it mean for us specifically? Well, to be quite honest, it doesn't mean much more for us than it would the resident of the state of Oklahoma, because if either the Wolverines or the Sparties come up with a vaccine, it'll be available nationwide, right? But it's good that research is happening here. I've had good conversations with the leadership of Bay McLaren, and they are keeping abreast of all of these advancements. We are really in the early stages. We were not really sure. Bottom line, the serological testing really just isn't there yet. Eventually, when it is, then that will be objective data that will help us make our public policy decisions. If today we knew that people would become effectively immune if they had a minor case and didn't realize it, but then we knew everybody who had it and was now okay, that would help us come up with less restrictive executive orders. What we've always been doing is dealing with the fact that we didn't have adequate testing coming to us from the federal government. And if you have to make a decision and you're effectively flying blind in the beginning, you can either err on the side of caution or on the side of risk. And we erred on the side of caution. The more information that we have, then the less restrictive all of our decisions can be.
Great, thank you. The last question that we have time for today related to paycheck protection. So I'm going to put this one over to Trevor, but Representative Elder, feel free to jump in. Michigan was really hit hard with COVID-19 and our unemployment claims. I mean, our unemployment jumped, roughly 20% nearly overnight. And wondering if the question is, can we explain why we received so few paycheck protection loans as a whole?
I think we can guess to it, and not necessarily make conjecture. that we received less, or maybe we'll receive more this time. But that being said, I think one of the things that you're going to want to do if you're still looking to apply for those funds is you're going to have to be prepared with information and documentation that's going to be asked as part of the application process. I think sometimes that can hamper the process, or that can maybe take a really great business or really great need or a really great loan and kind of put that towards, the back burner in the back of the line. You need to have, your 2019 tax returns. You need to have your payroll reports. You need to have mortgage or rent documents. You have to have a documentation of utility expenses if you're going to use some of your utility expenses as that loan dollar amount, right? If you're going to be looking to get a utility for your loan used for some of your utility expenses along with payroll. Documentation of how the coronavirus has negatively impacted your business. Some of those questions are all going to be asked. One of the things I think was really interesting and was unintended in the first round was that dollars were going to go towards, some of those larger banks also, that there's been a niche, tens of billions of dollars that are cut out for small community banks and smaller mom and pop type businesses. Specifically minority-owned businesses or female, majority woman-owned businesses, so that those dollars are being injected into the places that we frequent on a daily basis or a weekly basis. Those ones that those companies that we really have close to us here in Bay County. So I would say, focusing on being prepared. And I can't really lend any insight as to why we didn't get more, we didn't get less. I think the hope is if you're prepared, we're going to get more this time with better applications and a quicker application process for our small businesses.
Thanks, Trevor. And I think I did see a report out there that had Michigan getting about $10 billion, and some of that is, I know that there was an influx in applications, and so it was kind of hit and miss, and a lot of it at this point is conjecture until we see a little bit further along how many applications we actually had into the system, and how many applications went out, because it could have been a situation where people just weren't sure, knowing that they had to spend that money within that 8-week period of receiving the loan money, that they weren't sure that they could necessarily get that money spent, and so there could have been some people who didn't apply for it. So so with that, I think we've reached the end of our allotted time. I want to thank Representative Ryan Elder, Superintendent Deb Kadish, and Trevor Keys for joining us today. We will be posting this online on our website and also on our Facebook page to share with others. I think there was a lot of good information shared, and we look forward to having Representative Elder continuing to advocate for Bay County, for the businesses here and for all of the employees. So, thank you very much.
Thank you.
Thanks.
Thank you.